Hello?
Hello?
I got disconnected. This is Karen,
So
and
did
now
I.
I'm back.
I did too. This is Carlisle. I just called back in.
Oh dear, wonder what's happening.
I got disconnected as well. This is Matthew.
I know we have storms coming through our area. I don't know if that had any kind of a impact on a switch somewhere.
Yeah, because if they lost power in Winston-Salem, it could be, but it's strange that the phone would go out.
I know.
Who's still here?
So Tony, Jim, Matthew, Carlisle, and I believe I heard Karen were the ones that are online presently.
Oh, okay.
Yes,
Yeah, this is Matthew.
I think we lost Marlene.
Yeah, and she was the one providing the update.
She was. I think our main question though was, where do we want to house the information about resources and services? Do we want to look at NC 360 or the Recovery Alliance website? That was our main concern or question. Because I think we have an idea that NC 360 would be monitored more closely and checked in regard to updates in terms of resources, where we had questions about the other websites. Is that correct?
I believe you are correct.
Okay. Now, do we have anybody that represents that website or that particular organization or way to contact them to ask?
So Carlisle, do you know where that resides in Care 360?
Yeah, it resides within, well, I'm sure there's probably a technical component that's different than this, but basically it's under the North Carolina Department of Health and Human Services. And then I'm looking at their website. They also talked about a public-private partnership between them and the Foundation for Health, Leadership, and Innovation. And they're also partners with the United Way. And but basically, I think of DHHS as really being the main go-to partner.
Is that not only open like in 2 places right now?
I believe so. I think they're rolling it out in different phases. And I think they've just, they added a couple of counties just the other day.
Yeah, there was a presentation at the APNC conference on Wednesday, and they did a demonstration of that, and it seemed like a really great thing, but I don't know how long. I do not remember if they said how long it would take to get it statewide.
Yeah, it looks here like they're planning for full implementation by the end of 2020.
Yeah, I knew it was at least a year down the road.
So that's like 18 months maybe.
Mm-hmm.
So the conversation revolved around, should we focus, if we're trying to integrate a healthy community, should we continue to focus our attention on that particular site, or should we do something else? Should we gear folks in that direction, et cetera? 18 months seems like a long time.
Right. Now, one question I have is when we talk about a community, we could go in different directions there. I think of my community locally as being where I live, and then the Alliance community as being 4 counties. So 4 out of 100 counties is a small part. And then meanwhile, some of you represent Guilford, or, you know, and I'm wondering is our scope to be looking at each community in North Carolina should have access to a comprehensive list of resources, or is it a particular community? You know, where do we start?
Well, and at least some of the conversation that we had when we were in Raleigh is the fact that the LME MCO alignment may work, it may not work. What are the regions? How do we define that? And et cetera. I think it's the issue of, that's why everybody's having a hard time eating this elephant, is we can't decide what to take the first bite.
Well, what if we develop something, this is Matthew, what if we develop something in Guilford County as a starting from, and then see if we can either integrate it on the 360 website, or at least we would have the resources already pooled in Guilford County.
Yeah, that'd be fine, Matthew. We could certainly start that process.
It might be good to have a pilot that then could, you know, learn from that, and then take that back and recommend how others might take the same approach.
Well, and I really hate that we lost Marlena off this call, because I think she had started to do a fair amount of that in the Forsyth community.
Yeah.
And is she back on the line by chance?
I haven't heard her. I heard a couple of clicks there. It seemed like somebody wanted to get online, but then it went dead. So I don't know if she was trying to get back on and couldn't, or what.
So let me reach out to her by email as soon as we complete today and start the conversation of a pilot. And I'll also reach back out to Deborah to get a sense of scope on that particular thing. And then we can really start to put maybe our hands around a smaller project so that we can get some sense of accomplishment, and then maybe grow that into a larger initiative. The other conversation we had was where are resources available and what are the potential roadblocks that are out there. And y'all had thrown up a couple of really good resources. The LME needs assessment, Carlisle, you had brought up. Someone brought up Transforming Youth Recovery database, and then talking about the nonprofit databases that were out. Does anybody have any update on any of those?
Well, this is Tony. I had gotten kicked off too. It said the organizer ended the meeting a while ago, and it took me a while to get back. But in the now I'm in Hickory now, and so I'm not connected with Mecklenburg. But when I was there, we were working on a database of resources, but it kind of, I think, went a different way than what we're talking about, because it's sort of started going in a direction of not just, okay, what's out there that our folks need, but what's out there, and is there a way to actually look and see, is it a credible source? You know, that just because somebody said, oh, hey, yeah, I provide that service, they wouldn't necessarily be listed on the website.
Yeah, Tony, and that's always a concern.
Yeah. And that was what our thinking was about NC 360, is they would vet the providers to see how their legitimacy and their sustainability in terms of, you know, how long these things are going to be lasting. It's kind of like Suboxone clinics. They're popping up everywhere, but they close just as quickly. So,
yeah,
you know, just as soon as I find a Suboxone clinic, then, oh yeah, that one's not open anymore, I hear. You know, that's been the difficulty. I was also thinking in terms of a pilot project, just starting with emergency-related services throughout the state, like finding out who's doing well checks. What is it an ambulance company or actually EMS? That most LMEs are aligned with, in terms of doing well checks on patients. I think that kind of a database would be the most helpful for more emergent needs.
Yeah, and Karen, we can pull that together very easily from the state. They actually have all licensed providers by county. And that would be a great database to put in a central location without digging through the DHHS website, which you have to do now.
That would be wonderful for EMS. State
So I
has
can
a
get
data.
a non-emergency number and et cetera for each of those. That's very easy to do.
Oh, I think that's our most prevalent need, is what to do when there's a crisis and who to contact when they're not in your area. You know, because then I end up a lot of back and forth.
I think the LME MCO's 24-hour call numbers, it's good to have those as well as I often recommend, you know, that people start there if they're looking for a crisis service, because they may have access to things like mobile crisis that you wouldn't necessarily know to call about, or they might know of the behavioral health urgent cares that we're setting up, and they're more of the urgent care settings and mobile crisis options, and so maybe good to offer those. That also gives more of a resource that works across the state.
Yeah, that's excellent.
Yeah,
And
both of
Marlena
those.
just sent an email to everyone saying that she's sorry that the call dropped, but their power went out and their internet's been lost
Oh my God.
in the Winston area. And so as soon as she can get everything back online, she's going to send some information that she has to all of us.
Okay.
Okay, good. Yeah, I see that.
Yeah. Yeah, those three particular items, I think, should be first on our list to house in this maybe NC 360 under emergency, because I'm looking under all of the, you know, data, all of the titles that they have. If anybody else is able to look at the nc.gov page.
Yeah.
I mean the ncdhs.gov page or the NC3.
I'm looking under, yeah, NC 360, and I'm looking under services. And I'm trying to find where, if it says crisis. No, it doesn't even have crisis as a heading.
Correct.
Or emergent. Or even urgent for that matter.
But even if you click on provider information, there's nothing really there about providers.
It's not under emergency. And the agencies. Yeah, and those three items would be super helpful to house in terms of getting a database list, because the majority of them won't probably change too quickly. Carlisle, is there any LMEs or MCOs that are going to be closing or combining their services? Is there any more change with that?
Not that we're aware of right now, but that is a possibility. We'll have mergers. Yeah. We're
So
hoping
right now,
not.
how many is there?
There's 7.
7, okay. 7 MCOs. All right. Well, hopefully for the most part, that won't change too quickly.
Right. But then there will also be in November, there will be 4 standard plans that start up.
Right. The insurance is a whole nother,
Right.
issue.
Right.
All right, so let's take these as actionable items out of today. I think developing a database and pushing it through to NC Care 360, it sounds like we ought to reach out to them specifically to see if we can provide some updates to them around who are the emergency care providers by county, working to link the MCO, LME call centers into that, and then a listing of the BHUCs that are in the county. And that would be a good first swath of some success, I think, if we could get those up on that website.
I totally agree.
Mm-hmm.
Because even under agencies, it doesn't say emergency. Emergency Management Division. Emergency Management Division under DPS.
Karen, what website are you on?
I'm on, it's called nc.gov.
Well, I'm under ncdhs.gov, nccare 360.
Yeah, I put in NC360 and this is what it came to. nc.gov.
Yeah, try nccare360.org, and it at least starts to give some breakdown, but it's clearly missing a lot of population of providers.
Right.
Okay.
Because if you go under mental and behavioral health, crisis intervention, and et cetera, there's only a single provider showing up in the Greensboro area.
Yeah, that NC Gov was actually pretty good, a little bit even better than this one. But yes, no, it didn't have any reference to emergency. Let's see, are you looking under assistance providers? Okay, so LME MCO directory, it already has that under providers.
Okay.
And it's got a map. Via Cardinal Partner Behavioral Alliance, Sand Hills, Trillium, East Point. Okay. That's a good start. But urgent care is another new phenomenon within behavioral health that I don't think is getting a whole lot of coverage, that it certainly could be more useful or utilized more frequently.
Carlisle, do you know of a listing of the BHUCs in the state?
No. I think it might be more by LME MCO. Yeah, because we just opened one last week that is in Raleigh, and we have one in Durham. Those are the only ones I know of in our catchment area, but yeah,
we're building one now, but we're 2 years off from occupancy, and obviously there's one in Asheville that I think most of us have been to. So, so with that being said, maybe we could poll the MCOs to find that, and we can do that through DHHS, I would imagine.
Right.
Sounds great.
All right, so I will take each of these as an actionable item, and in the interest of time, I know, Carlisle, you've got to jump off for another meeting, and I'm sure several others do. Perhaps we could rally around again in the span of about a month. Second Monday at 1 o'clock would be June 10th at 1, if that time and date works.
It does for me right now. I don't see.
Actually,
no.
I have an all-day meeting that day. There's a disaster preparedness meeting, a statewide meeting that day. I don't know if you go to those at Jim or.
Yeah, I have staff that attends, but we could certainly move it.
Okay.
What about the third?
What about the third?
What would that date be, Jim?
I could do a little bit earlier. Any chance we could do like noon?
Sure.
That would work. I've got a 1 o'clock meeting.
Now, when you say the third, you mean the 3rd of June or the third Monday in June?
You mean the 17th of June?
The 3rd of June.
Okay. I couldn't do the 3rd. Well, if it is, I would not want to do the 3rd. I'll be on vacation.
I don't blame you.
What about the 17th?
The 17th is open for me. This is Tony.
So you're talking about the 17th, maybe? That's the third. 17th is fine.
That works for me.
If you prefer 12 o'clock or 1 o'clock?
I have a meeting at 1, but I could do 12.
All right, let's do 12 o'clock on the 17th.
Noon works.
12 works for me.
All right, and I'll get a Zoom ready. I will follow up on the items that we have discussed here. And Carlisle, I'll follow up with you to find the passageway into the MCO network that would be most
Okay.
effective to locate a couple of these service providers.
Okay, that sounds good.
And Jim, I'm going to follow up with you about the EMS state database because I want to get a link to that from you possibly.
Absolutely.
And then we can combine our resources in terms
Yeah.
of what's going on locally.
And I'll send what I have to you right now, Karen, and then we'll get
Great.
something better than that moving forward and then try to populate it to this website.
Excellent.
And I'm gonna drop off the call here. Thanks, everybody.
Thank you.
All right. Thank you.
So Jim, this is Matthew, would it be helpful to just real quickly send an email out about what those items are? So anybody that wasn't able to be here, we can at least send the email to them.
Absolutely. I'm going to do a follow-up and try to get a little better organized for the next event and get this all pulled together and then reach out to Deborah as well so that we've got a little conversation going with them. And then we will be better prepared for the meeting on the 17th. And I hope we can use the same link, which would make it easier for folks if we can just keep some continuity of our communications network.
Yeah, I agree.
All right. Well, thank you all very much for jumping on today. And thank you for all the work that you're doing in your respective communities.
All right. Well, you're welcome.
Thanks
Look
to
forward
everybody.
June 17th.
Very good.
All right. Thank you.
Take care.
Thanks so much. Bye-bye.
Bye.
Bye-bye.